Hello, everyone, and welcome to the ITE Prep webinar. Thank you for attending today. With IT launching in less than a month, today's big question is, are you ready for ITE? I am pleased to introduce our two speakers today. Dr. Elaine Pelly from the University of Wisconsin acts as the ITE Steering Group Chair and leads a group of expert endocrinologists in the formation of ITE each year. Dr. Alan Chang, now at Stony Brook University, previously acted as the APD for Drexel University's fellowship program and played a large role in working with and preparing fellows for ITE. Thank you both for joining us today to share your expertise and a comprehensive overview of ITE. Here is an overview of today's agenda. Dr. Pelly will walk us through the history and development of ESAP ITE. Dr. Chang will explore the administrator's role, and I will give a quick summary of the logistics around ITE. There will also be some time for Q&A using the question box. And so with that, I turn it over to Elaine.
Good morning. Thanks, Maggie. So the ITE is best thought of as a question-based learning resource for your fellows, and it's intended to help you gauge the level of knowledge of your fellows in various topical areas of endocrinology. When we build the exam, the questions that we select are picked with a few criteria in mind. First, we try to align the questions with the ABIM topical blueprint for endocrinology so that the exam represents a balanced breadth of topics in endocrinology. We also are selecting from question banks that the Endocrine Society has on file. And so if questions that we're using have metrics, quality metrics from prior use, we try to select higher quality questions. Then our faculty experts select from those questions, those question banks, which questions they feel have learning objectives that would be useful for our fellows to know. One important point is that the ITE is not really intended to be board's prep material, nor can we say that it will be indicative of board success. Because we build a new exam each year, we really can't prospectively determine whether the performance in an ITE will or won't predict board's passing or board scores. Rather, we suggest that you think of it as a learning opportunity and a way to use as a benchmark tool to assess your fellows' current knowledge and where additional support might be needed. So the current process of developing the ITE was formalized back in 2015 when the ITE steering group was formed. And each ITE since ITE 2016 has been developed by roughly the same process. So the ITE steering group creates a new exam each year, as you know, launches in mid-January. The steering group includes a faculty ranging from recent fellowship graduates to senior experts in the field, because we want multiple perspectives on the questions that are selected, and multiple backgrounds and areas of expertise. So for each major topical area in endocrinology, we have a single faculty member that serves as a topical lead, and then that individual works with 2 or 3 other experts in that field to select the questions that cover that subsection of the ABIM blueprint. There's an intention to include questions with a range of difficulties. So we attempt to select questions, some of which we think we would call more fundamental questions, or questions that most first-year fellows would know, and then questions that we think only likely more advanced fellows would know. So trying to get a balance of difficulty of the questions on the exam. And once we have these questions pooled and assembled into the full exam, then the exam goes through at least 3 rounds of peer review so that we get the input of the other members of the steering group, even the input of those that have expertise in other areas, which helps sort of balance out the selection of the content expertise to those that might have a more general view of endocrinology. And then finally, we go through several rounds of professional editing and revising of the questions to try to make them appropriate length and quality for ITE. So the ESAP ITE, our ITE, is really the only tool of its kind. All the other areas of specialties do have ITEs, but they use secure exams that reuse their questions year after year. The upside of this is it allows them to curate a statistically reliable exam over time. They are able to beta test questions, pick the ones that perform well, keep those, and discard the other ones. But this process really doesn't allow for the ITE to be a learning opportunity for the test takers. With our ITE, we are trying to provide sort of the best of both worlds to you by having the ITE serve as both an assessment as well as a learning tool. And we achieve this goal of it being a learning tool by building a new exam each year of our peer-reviewed questions, and then we release the questions and answers after the exam, including references. And then we attend the exam to be a springboard for discussion and new learning at your programs. So we hope that program directors and program leadership will work through the questions with the fellows, utilize the included references for each question and to broaden the understanding of each topic. So since the ESAP ITE is meant to be a learning opportunity, it's important to realize that by definition, it must include questions that cover learning objectives the fellows may not know yet. While this makes the exam difficult, one thing to note is that our ITE exam difficulty is pretty on track with other ITEs. The mean score we see is roughly in the 60s, which is similar to what other specialties report. So having questions with a breadth of difficulty provides a unique opportunity to gauge your fellows' knowledge and clinical decision-making skills, as well as allows for fellows to learn new content by reviewing this exam. While we do try to ensure that all the questions have a clear best answer, so there is often some nuance to these types of questions, and some programs may find that their own faculty don't always agree with what the correct answer is provided on the exam. This can happen when writing questions in very subspecialized areas and reflects the nuanced reality of our field. But even this can be used as a learning opportunity to prompt good discussion at your local institution. All that being said, with the difficulty of the exam, expectation setting with your fellows is super important. You should remind them that this is a no-stakes exam, and that it is completely expected that there are questions they will not know. And then emphasize that you will work through these questions with them after the exam. And you will also review with each fellow how they fared overall on the exam in comparison to all test takers at their training level. This expectation setting is particularly important for your first-year fellows who are likely to find the exam more difficult and also who haven't taken this type of exam before. While the primary goal is for this to be a learning tool, it is important, since it is an exam, that it also function well as an assessment. And to do this, it must have both validity and reliability. For those that are not familiar with these concepts, validity means that an exam accurately portrays fellow knowledge of a subject, in this case, clinical endocrinology. So the validity of our exam is supported by several things. Number one, it's created and peer-reviewed by experts in the field who feel that this is relevant content for fellows to know and learn. We also get really good qualitative feedback from fellows and program directors over the years, stating that the exam was useful and relevant. But in terms of statistics, one of the best markers of the validity of our ITE as an assessment of the learning that occurs throughout a fellowship program is that we do see higher average scores in our second-year fellows than our first-year fellows. Our ITE also has assessment reliability, which means that it consistently measures fellows' knowledge, that there isn't a lot of noise in the scores that is due to random chance. We can never know this prospectively. Reliability can only be assessed on exam after it's delivered. But we did do a retrospective review of the statistical reliability of the ITE since the steering group was formed, and found that our current process yields a reliability in the range of 0.72 to 0.76, which is a quite reasonable result for a first delivery of an exam with no ability to beta test questions ahead of time. The validity and reliability factors suggest that this ITE can be used as a reasonable assessment of global knowledge of clinical endocrinology, and so it's a pretty good test of your fellows' knowledge. However, minor differences in scores should not be overinterpreted. Program directors should look for outliers as well as individuals who might benefit from extra support. National data points are included in the score report that will be released in March, so you can see how your fellows perform as compared to all test takers.
Thank you, Dr. Pelly, for that overview of IT's history and development. Here's a quick summary of the major points that Dr. Pelly just covered, which are that there's a new exam each year created by expert faculty. Answer explanations are released to facilitate remediation and learning between the program director and the fellow. It provides an accurate representation of endocrine problem solving and represents the nuances of the field, and that the scores are valid and also reliable. And now we'll hear from Alan Chang regarding preparing your fellows.
Thank you, Dr. Pelly, and thank you, Maggie, and good afternoon. So why do we use the ITE? Well, the ITE can be a comprehensive tool to better test how your fellows are doing in terms of understanding the content, dissecting cases, and making the appropriate clinical decision-making skills that they will need as future endocrinologists. As Dr. Pelly said earlier, each March, the Endocrine Society releases a report with the national averages, your program's averages, and the individual scores. This tool provides an invaluable insight into each fellow's strengths and weaknesses and does allow for targeted learning by releasing the questions along with the score reports afterwards. So one can sit down with each fellow and review specific areas if needed in areas that they find challenging, and this allows for a true teaching moment. And also, very importantly, the fellows can actually see how they're progressing year to year, from first year to second year, and that could be a boost to the morale as well. So, how does one prepare the fellows for the ITE? And I guess that's the elephant in the room. Well, as we all know, preparing for the ITE is not something that's done one day or even a few weeks prior or even a few months. I always tell the fellows from the first months of their fellowship, that they have to start thinking forward in terms of IT studying and eventually board exam studying. For the fellows, this is somewhat of a Damocles sword, this quote-unquote infamous ITE always hanging over their heads. And this actually weighs down on the first-year fellows, more so than the second year, I feel. There are many ways to prepare the fellows, and it also includes working with other modules, such as the Fellow Training Series modules that the Endocrine Society also releases. And specifically with the FTS modules, the fellows become more comfortable using the platform, and of course, the modules themselves offer supplemental resources for your standard curriculum that you have at your institution. And also, as Dr. Pelly said earlier, it's also important to note the exam covers a large number of endocrine topical areas, and the best way to prepare your fellows to work through your curriculum is with them and to focus with them after post-exam on what needs work. So with that being said, of course, the ITE is invaluable, but another linchpin, I feel, for helping the fellows is the yearly ESAP questions that are released by the Endocrine Society every year. So with those two resources together, it's a great supplement for each other. So the advantages to using the yearly ESAP questions are threefold. Number one, it helps the fellows to develop a mindset of how to think and analyze the questions that the ITE expect them to. It's a very different kind of thinking than perhaps they were used to back as a resident. Number two, it helps the fellows realize that there are topics that they don't even know that they don't know. For example, I remember my first attempt at ESAP, there were lots of questions. I had no idea what they were asking me about, and made me realize, there are topics that I need to just read up on without even knowing that they existed. And number three, it helps the trainees understand that questions to answers are not always black and white, especially to the first-year fellows particularly. All the answer choices, they look fine. They all look correct. But they need to realize that there is a best answer that's based on the guidelines, current literature, or whatever paper that came out somewhat recently. This kind of thinking that there's a best answer, even though everything looks right, it doesn't occur overnight, and it doesn't just come with doing an yearly exam. They have to prepare early, obviously, maybe as soon after fellowship starts. So, how does one prep the fellows? And there's no right answer, obviously. So from now on, I'll be telling you how I did it at Drexel. So number one, I stressed to all the fellows early on in the academic year, and I reinforced it continuously, that any exam preparation sessions that we do, it does not count against them. It does not count against them on their evaluations, and that it has no bearing whatsoever on how I view them while in the clinic or in the hospital. It's a totally separate thing. Like we said earlier, this is a no-stakes exam, and prepping is also the same thing, no stakes. At Drexel, we used to have a weekly 1 to 2 hour sessions every week. And this actually was done after hours, after the workday, so that fellows would not be bombarded with pages, or they wouldn't be distracted by any callbacks for the patients or any clinical duties. Obviously, this needs, I guess, motivation for the fellows to stay after hours, but most of our fellows did. The chief fellow and I actually would sit down at the beginning of every academic year and plan an outline of the schedule of the sessions throughout for the whole year. Okay, so the actual sessions themselves, what we did was we split it evenly between doing the yearly ESAP question per session, and also having the fellows read papers, review articles, whatever we found not necessary or engaging. We would then stagger the weeks. So 1 week would be questions, the next week will be the reading assignments, the next week will be questions, next week will be reading assignments, so on and so forth. So it does give the fellows about 2 weeks to get any reading materials done. The yearly ESAP questions can come from multiple years, although normally we just use the year prior. So which questions did we actually do at the time? It ranged. Sometimes the fellows said they want to do random questions, so we would just go on to the website and we just pick a block and just do it, 1 to 20, whatever. Or sometimes the fellows would say, we want a topical focused session. So we would just do the yearly ESAP questions on one topic, thyroid, for example, or just adrenals, depending on what the fellows wanted and what they feel like they needed. And in the actual sessions of doing the questions, once the fellows would take turns reading the questions out loud, and whoever read the question would try to answer it, either successfully or unsuccessfully. So importantly, this could obviously lead to anxiety among the fellows, especially the new fellows, since their knowledge base isn't as broad. So it was very vitally important for us to stress to them about how it's a safe zone and that no one is judging them and that they are not being evaluated. And the fellows and I would joke around all the time that they were in a safe space during these 1 to 2 hour sessions. If the fellow reading the question got the question wrong, the other fellows would actually have the opportunity to jump in and answer it. And if another fellow gets the answer correctly, then the fellow will have to explain the rationale. Why do they think it was that answer? And we will go through the explanation pretty minutely, actually. Again, it's for me at least, and for us, it wasn't just about getting the question right. It was about how they got to the correct answer, the thought process. I think that the thought process is so much more paramount to just getting the correct answer. And of course, if the fellow gets the answer correctly, we still go through the explanation as well, but fairly quickly, unless any fellows have an issue or question about the explanation. Okay, so that's how we did the question sessions. For the reading assignments, we primarily used the book Greenspan, or sometimes Williams, and the fellows and I would decide on what chapters or what block pages that we wanted to review. The goal was never to finish the book, but rather have a better understanding of the background of certain topics. Doing this for years, I see that the fellows, a lot of times, they get caught up in the clinical presentation of a patient and in the treatment, which is very, very understandable. But a lot of times they do forget the pathophysiology behind the disease process. So we found that having these readings or papers, whatever, were extremely useful for just reinforcing basic science. And since the reading is every other week, the fellows have usually about 2 weeks to finish whatever is asked of them, and the fellows, them being fellows, they always get the work done for the most part. Admittedly, this is actually a very schedule for both the faculty and fellow, and of course, not every fellow wants to stay after hours, and that's fair enough. So I always make it known that their participation is purely voluntary, that this is just something that I do for them, and if they have to study on their own term and times, that's fine. Everyone believes differently, and that's perfectly acceptable as well. I would say historically, most of my fellows did stay, maybe not for the whole time, but they did stay, and they never regretted it, so to speak. So, before the exam, there's a few things to do. Besides preparing your fellows, obviously, there are a few key steps to take to make sure your program is ready for the ITE. It is important to let the Endocrine Society know who your current PD, APD, and program coordinator are, so they can be added to any program pages. And one also needs to determine who will proctor the exam. Make sure that to be on the lookout for emails from the Endocrine Society, which contain important information for paying your invoices, enrolling your fellows, and accessing the different courses and resources. A week or so before the exam launches, you will get an access code and day of instructions. Those codes will need to be kept secret until your fellows are taking the exam, so they don't look at the exam beforehand and steal the results. I mean, I honestly don't think any fellow nowadays would do that, but that's very prudent. And at Drexel, our fellowship coordinator was the one who had the access code, and she was also the one who proctored the exam and did any troubleshooting if needed. Okay. So the big day is here, the day of the exam. So on the day of the exam, the proctor and the fellow should gather in the exam room about half an hour prior and navigate to the site to ensure that there are no access or technology issues. The proctor then should provide the access code at the start time, either by putting it up on the screen, dictating it, or some proctors prefer to enter it into each fellow's computer. There is no wrong way, obviously. It's also very imperative to make sure that your fellows are not experiencing any technological issues and that there's a steady internet connection in the room. And of course, don't forget, it is of utmost importance that you ensure your fellows are not using outside resources, such as the internet or text. And again, I will be very surprised if that happens nowadays. And at Drexel, we would, on the day of the exam, the attendees, we would hold on to the fellows' pagers, so obviously they won't get paged in the middle of the exam. And we had the fellows not have any clinical duties for half the day or even the whole day, depending on how turned out they are. Okay, so the exam is over, and it's now afterwards. So post-exam, the ITE score reports are released and available on the program's page in early March. After the ITE scores are released, one should sit down with each fellow and assess which topical areas they struggle with, review questions, and answer explanations, and develop a plan for focusing on these troubled areas. So it's also extremely important to set expectations for your fellows. AKA, this is a tool just to help you, the fellow, identify which areas you need help with. This is a no-stakes exam to guide future learning, intended to be a closed book, and because of this, it is also very important to note that in most cases, first-year fellows will not do as well as second-year fellows, and that is true from my experience at Drexel. So, at Drexel, the fellows were never happy with their scores. They were never happy. And they know that the exam doesn't count against them. We tell them this constantly, but that doesn't alleviate the impact of doing more, doing poorer than they're used to in the past. I mean, and it's understandable. These are people who finished medical school, did residency, are now in the fellowship, they're ambitious, and they're not used to doing poorly. And I don't think there's not much anything else we could say to them that can make them feel better besides time. Intellectually, they know that this doesn't count against them, But just reinforce it as much as you can. That's what we did. So there were a few things we did at Drexel after the exam that we thought did help the fellows. So the first thing we did was after the questions and answers are released from the ITE, we actually go through the questions in our weekly sessions, and we dissect the cases. We just go right through them 1 to 90, whatever it is, and of course, the fellows, they always remember which answer they weren't sure, which answer they know they got wrong, and that's okay. And the thing is, once they go through the questions they thought they got wrong, and they go through the answer choices and the explanations and find out why they got it wrong, you can always almost see a light bulb go off over their heads. You can actually see how they're thinking, how they're changing their thinking. So that's what we always that's what we always did, and we do factor this time into the schedule at the beginning of every academic year. We also asked outside lecturers to come in and lecture the fellows for anything ran rounds. And this could be whatever they need: ENT, reproductive, OBGYN, bariatric surgeons. So that was also quite helpful as well. We also use the fellow training series. We use this throughout the whole year, actually. But sometimes, it pays to go back to whatever a case that's presented that that they did poorly on, and just go through and review the case again with them. And finally, we always had one-on-one individual teaching for the fellows if the fellows felt that they could benefit more from that. And what that usually meant was that we would do specific questions from the yearly ESAP, so not just the year before, but we would, let's say they need thyroid support. We would just go through, 2-3 years just worth of thyroid questions and go through it, or we would give them assigned cases to whatever they needed. Okay. At Drexel, we did not use any specific cutoff percentage to determine whether a fellow needs one-on-one teaching, and honestly, at this point in their career, it's the fellows who usually knows what they need. They're the ones who usually come to us. We don't go to them unless we really feel like they need to. But they're ambitious people. They come and they say, "Hey, I need this," and we help them. And to be honest, not many fellows needed one-on-one teaching at Drexel, at least, which is a good thing. And historically, I think this approach has worked pretty well. All the fellows under exit interview has always stated that the yearly ITE was invaluable in terms of knowing where they were weak at, what their strengths were, and all the fellows always felt that our system of prepping them prior and post exam was quite invaluable during their fellowship, especially after they took the actual exams, and they felt that it was helpful as well.
Thank you, Dr. Chang, for that insight into the admin's role. Here's a quick snapshot of what Dr. Chang just covered, which is that it's important to work through the curriculum and supplemental tools, that you should remind your fellows this is an opportunity for increased understanding, and that working with your fellows post-exam to help remediate is a unique opportunity to work through any confusion, assess decision-making, and guide the fellow through gaps in their knowledge. So thank you, Dr. Pelly and Dr. Chang, for the detailed overviews of the ESAP ITE and the administrator's role in preparing the fellows. I'm going to cover just a few logistical reminders in the next few minutes. So invoices for FTS are released each July and are based on the package you had in the previous year. The total amount is based on your ACGME size, and the invoice will be under the Bill to Persons account. If you have changes to make to your invoice, and you should contact mgraham@endocrine.org. You will not have access to any of the FTS materials, including ESAP ITE, until your invoice has been paid. This includes new modules that are actively being created, and we are about to release new modules around obesity and rare bone. Once your invoice is paid, you will receive instructions on enrolling your fellows. We ask that you check your email regularly, as we will be sending vital details in each message. Please make sure you have endocrine.org on your safe list so important emails aren't blocked. We want to make sure you have payment information, instructions, and details for ITE so your fellows don't miss out on this resource. And as Dr. Chang said, make sure you update us on who your current PD, APD, and PC are so that we are contacting the correct people. After your fellows have been enrolled, you can have them work through the other curriculum items, as Dr. Chang and Dr. Pelly both mentioned. You will not be receiving many messages until right before ESAP ITE launches in mid-January, so don't worry if you aren't being flooded with emails. Make sure you check with your IT department regarding internet access. The exam is internet-based, so you must be in a major web browser like Internet Explorer 10+, Firefox 32+, Safari 7+, or Chrome 37+, and cookies do need to be enabled. A few days before ITE launches in mid-January, you will receive access instructions and a super secret access code. Please do not share this with your fellows before the exam. They should only have access to ITE at the date and time you select to ensure an accurate score. Because we are using ITE as a tool to gauge gaps in knowledge, it is important that the fellows do not know the questions until they are taking the exam, so they answer accurately to their knowledge level. A few weeks after the exam closes, score reports will be released, sometime in the first couple of weeks of March. These should be used, as Dr. Chang and Dr. Pelly mentioned, to guide your fellows through remediation. Then at Endo each year, there is an ESAP ITE live session to go over commonly missed questions by section. At Endo 2020, the live session will be on Monday, March 30th from 9:15 to 10:45 a.m. Lastly, if you have an opinion about FTS, the module created, the format, etc., we actually have a survey going around now that I will share a link for via email, so you can help us make this program what you need. So now we have some time scheduled for Q&A, and you can use the chat box to ask your questions, and I will read them to the panelists. Okay, so they asked if we could list the internet browsers again, and please note that this is also available online at the FAQs, which are listed in your program pages. But they are Internet Explorer 10 Plus, Firefox 32 Plus, Safari 7 Plus, or Chrome 37 Plus. And I would also recommend checking with your IT department to make sure everything is just up to date. We just got another question about if this will be recorded. Yes, it is being recorded, and in a couple of days it will be up on the Center for Learning, and I will also email it out to all registrants. The next question is, will the fellows be contacted about their score reports? And the answer is no. All correspondence goes through the program director, so it is your responsibility to get the score reports, share them with your fellows, and go over your scores with them. So the next question is, if our fellows need to take the exam at different times, is that possible? We do prefer to have your fellows all take the exam at one time so that the fellows who took the exam first don't share their results or the questions with the fellows who are taking it later. However, if with clinical schedules that is what is needed, it is possible. We just ask that you really drive home to your fellows that they shouldn't share what the questions were until after everyone has taken it. Next question. What are the IT support hours at the Endocrine Society? IT support is available from 8 a.m. to 4 p.m. every day, Monday through Friday. If you will be taking your exam on a weekend or beyond those hours, you should go ahead and email me at mgraham@endocrine.org. I'm sure you've gotten emails from me before. And I will go ahead and make sure that someone is available to provide IT support. Next question, how do I know that I have properly enrolled my fellows? The quickest way to check is to log into your account at the Center for Learning, go to your program page, and then click the blue View Activities button. Then next to each course in question, if you click Manage, it's a blue hyperlink next to the hyperlink for Add, and you'll be able to see a list of everyone enrolled in that course. And if you're having difficulty finding that, you can always email me and I can check for you. Next question is there anything special we should have our fellows do? And the biggest thing is just have them log into the Center for Learning, which is education.endocrine.org, and go to pending activities to make sure that the exam is appearing in their pending activities. And I think now is also a great time to remind you that how admins access courses versus how fellows access courses is very different. So fellows will always access through pending activities. If they go in through the admin view, they will always get an access denied message. Next question, are program directors allowed to attend ITE Live? Yes, program directors, program coordinators, associate program directors, and fellows are all invited and encouraged to attend ESAP ITE Live, as it is a great opportunity to talk to the experts who created the exam and go over any questions that you might have some concerns about still. Okay, last call for questions from the audience. So who should we contact if we have no pending activities? And you should contact me, mgraham@endocrine.org, and I will be able to troubleshoot for you to figure out why nothing is appearing. It's possible that you may not have added your fellows where they needed to, or that there may be a technological glitch. But in general, your first point of contact for all ESAP, ITE, and FTS related concerns should be to email me, and I'll be able to find your answer or find you someone who can. The next question is, should pop-up blockers be on or off? And they should be off. We don't have anything that pops up, but just in case something needed to launch in your system, but that shouldn't have an impact on your ability to take the exam. Hey, Dr. Pelly, Dr. Chang, do you have any last minute remarks or notes that you'd like to share?
No, I think I said everything. Just remember the ITE and the yearly ESAP questions, I feel, are just a great complementary material.
Yeah, I think I just always want to emphasize that fellows need to understand this is totally meant for their learning. It is not punitive. There are no stakes to it. And that if they come out of it knowing more than they knew when they started it, then it was a successful exam.
Thank you both so much. Now, if there are no more questions from the group, I'll give you back 20 minutes of your lives. Thank you again for attending. If you have questions, feedback, comments, you can contact me, Maggie, at mgraham@endocrine.org. Thank you.